Hello everyone, my name is Christian Morales, and for my microbiology signature assignment, I chose the topic Ebola. The Ebola virus belongs to the Filoviridae family of filoviruses, and it's an enveloped negative sense single-stranded RNA virus that targets and infects a variety of human cells, including macrophages, dendritic cells, fibroblasts, and endothelial cells. The virus enters the host cell through receptor-mediated endocytosis. Once inside, the viral RNA replicates using the cell's machinery, leading to production of new viral proteins and genomes. These components assemble into new viral particles that bud from the host cell membrane, killing the cell in the process. The released viruses then spread the infection to new cells in the body. Next, the transmission of Ebola virus disease is transmitted through direct contact with blood or other body fluids like saliva, sweat, feces, vomit, breast milk, or semen from an infected individual. The virus can survive for several days in fluids at room temperature or up to hours on dry surfaces, which facilitates spread through contaminated fomites. Infection occurs when the virus enters through broken skin or mucous membranes in the eyes, nose, or mouth. Ebola virus disease outbreaks often start when a spillover event from an infected animal reservoir like fruit bats to a human host. Avoiding contact with potentially infected bodily fluids and proper hygiene practices limit Ebola transmission. Moving on to slide 4, we'll be taking a look at the symptoms that come along with Ebola. Symptoms of Ebola infection include things like fever, headache, muscle pain, weakness, sore throat, fatigue, vomiting, diarrhea, and unexplained bleeding or bruising. These result from immune-mediated damage to blood vessels and cells. Long-term complications like vision loss, headaches, and joint pain may persist after recovery from Ebola. The average case fatality rate is around 50%, but it depends on the viral species, ranging from 25 to 90% in mortality rate. Next, age and blood viral load also influence the chances of survival rate from Ebola. Next, treatment and diagnosis of Ebola disease rely on tests like polymerase chain reaction tests that detect viral RNA or antibody tests, which indicate past infection. Supportive treatment focuses on balancing fluids and electrolytes, maintaining adequate oxygenation and blood pressure. Experimental drugs like ZMapp help alleviate symptoms but can have side effects including fever, shock, nausea, and diarrhea. There are currently no FDA-approved vaccines or antiviral therapies to cure Ebola virus disease. However, survivors develop lasting immunity against the same Ebola species. Many experience enduring health issues like fatigue, headache, memory loss, and muscle pain after recovery from Ebola. Next, I'll be going over the demographics and AI of Ebola. Ebola outbreaks occur most often in Central and West African countries. Those with contact to infected wildlife, patients, and healthcare workers have the highest risk of getting Ebola too. The 2014 to 2016 Western Africa epidemic caused over 28,000 suspected cases and 11,000 deaths in Africa, compared to only 11 US Ebola patients. And lastly, recent artificial intelligence models help predict the spread of Ebola virus disease based on patterns of transportation routes, populations, and past trends to inform containment strategies.